Good afternoon, everyone. My name is Tony Sigler. I'm your current broker for your healthcare um, policy through Scaffold Shrinkwrap. Today, we're going to be discussing some of the changes that we are having for this plan year. We've quoted multiple plans out there, and it seems like Aetna will be the best provider for this planned year for 2025, 2026. With that said, Aetna is also a national carrier, just like United. So you're going to be able to use this policy anywhere in the United States as long as you're in network with Aetna. And it also maintains an open access plan. So that means that you don't need referrals to go see any specialists. Unfortunately, United had a big increase, and we wanted to make sure that your deductions were as close as possible to last year's without sacrificing any of the benefits. And we were able to achieve that by moving with Aetna this year. So in this meeting, I'm going to cover a couple of things. I'm going to be talking about the medical. I'm also going to be talking about the supplemental policy with Transamerica that works together with your major medical. And then we're also going to be talking about dental and vision, which is remaining with Humana. Okay. Well, briefly, I wanted to discuss with you and go over our claims team. We have a full concierge team available to you and your employees in there with a full service team. That means that any ID cards that you may need or you lost one, you need to request a new set of ID cards. You can contact our service department at service@fdnational.com. The same as if you need to find a doctor near your home, add and remove a dependent that will be done through Shanika or Joshelle. They will be able to communicate with me to make those changes to your policy. But during this open enrollment period, you're going to be able to add or remove dependents and choose what policies you want your dependents to be enrolled on. So this is the time that you're going to be able to do that. And if you have any questions, obviously we can schedule a private meeting and go over any of those questions. For claims, any claims that you have, whether they're gap claims, which is your supplemental policy, prescription questions, prior authorizations, medical claims, you can always send an email to our claims@fdnational.com. Just make sure that you state your name, your company name, so we can locate your file and can assist you further. All right, so we're gonna go in the order from least expensive to the most expensive. And that being said, virtual visits will be the least, then your PCP, then you have your retail clinics, which are the clinics inside CVS and Walgreens, urgent cares, and then emergency room being the most expensive. Like I said, this year we actually moving with United. This policy is an EPO, which is a national policy, and it has a $5,000 deductible, which is lower than United's, and also a lower out-of-pocket, which is $7,500 versus $8,150. So right there, we are improving by a lower deductible plan and a lower out-of-pocket policy as well. Then you have your PCP copay of $35 and your specialist copay of $75. Your supplemental policy is Transamerica. That policy maintains the same, and supplemental policy, all it is a policy that works together with your major medical policy to cover some of that exposure the insurance company give you. For example, you have $5,000 available for outpatient services, which will apply towards your urgent care, ER, minor diagnostics, which are your labs, x-rays, and ultrasounds. And then you have your major diagnostics, which are your MRIs, your CT scans, and PET scans. Those will be major and outpatient surgeries. So that you have $5,000 available, in which you have $5,000, which covers your entire deductible. So whether you have an outpatient surgery, you need an MRI, or labs, you will be 100% covered up to your maximum deductible of $5,000. And then you will only have an exposure of $300 if you were to go through the ER. Your gap will cover your entire deductible, and then you only responsible for a $300 copay. You can also use your gap for urgent cares. So those $75 are covered under your $5,000 supplemental policy. And then your minute clinics, if done at CVS, they're 100% covered. And if you use any other clinic aside from CVS, such as Walgreens, then you will have a $35 copay. It is not covered through your supplemental policy. You also maintain your teledoc visits, which are your virtual visits. Those will be $35. And that's a copay that is not covered through supplemental policy. And your Transamerica maintains with a treatment rider, which means even though it does not cover your office copays, like your 35 primary, your $75 specialist copay, it does cover surgical procedures done at the doctor's office. What is an example? They say I go to the dermatologist, I pay my $75 copay, and then my dermatologist, my doctor says, hey, Tony, I have a mole I would like to remove, and I would like to have a biopsy done. Those biopsies will be treated as surgical procedures, and it could cost you anywhere from $150 to $200 per biopsy. In this case, you have $5,000 from your Transamerica to cover all those surgical procedures. How to use it? All you need to do is just show both your ID cards, your medical and your supplemental policy card. They will verify benefits. They will bill Transamerica directly, and then Transamerica pays them without having you to pay for it upfront. The policy remains no referrals needed, so it's an open access policy. And your deductible, like I said, is $5,000 for individual, $10,000 for family deductibles. And then your maximum out of pocket is $7,500, which is the most you can pay in one calendar year. If you ever meet that, then your insurance will kick in 100% thereafter, and you don't need to worry about having to meet your out of pocket until next year, January 1st. Okay. You also maintain a drug card of $3 for generics, $10 for preferred brands, 50 and 80 for non-preferred medications, and then specialty medication, 20% of the cost up to $250, or depending on the tier, 40% up to $500 copay. If any of you take expensive medications, you can always send our claims department an email at claims@fdnational.com, and we can help you find if they have any rebates or coupons available. A lot of this prescription pharmaceutical, they have rebates and discounts, and we can help you, send you a link. All you have to do is just click on it, register, and take advantage of lower prescription costs. Like I have mentioned earlier, your supplemental policy does not cover prescriptions. The dental maintains with Humana. One of the reasons why we maintain with Humana is because Humana still is one of the few companies that has unlimited benefits, no annual max. A lot of the other companies out there, they give you $1,000, $1,500, $2,000 at times. And once the insurance company pays that amount, then you have no coverage for the remainder of the year. Humana, on the other hand, it has no annual cap. So that means that whether you need one root canal, multiple root canals, they're going to continue to pay that 50% with no limitations. It also maintains a no waiting period policy, which means that if you were not enrolled last year and they decide to enroll this year, the moment you become effective, you can start using this benefit. You have your diagnostic services covered at 100%, which are your x-rays or evaluations and your 3 annual cleanings. That's covered at 100%. And then you only have a one-time deductible of $50 for individual policy that only applies for basic services and major services. What are basic services? Restorations, tooth extractions, cavities, those will be paid at 80%. You pay the 20%. And then major services are root canals, crowns, bridges, dentures. Those will be covered at 50% with no limitations. Another thing that I wanted to bring up, which is something that I get asked all the time, Your supplemental Transamerica hospital gap plan does not cover dental policies. Okay, so the supplemental policy only you can only be using it towards your medical policy with Aetna. Your Humana Vision plan stays with the same carrier, so no need to get rid of your ID cards if you have them with Humana. You can maintain and the Humana cards and use them. If you get one by mail, you can discard the old one and replace it with a new card. But if you don't get one by mail, the policy is not changing. It's the same policy. So your policy number will maintain the same and you'll be able to keep using your same ID card for your dental and the vision. The vision policy gives you a $130 frame allowance every 12 months from your last visit, or you can choose to get 130 allowance towards the cost of your contact lenses. You have a $10 eye exam copay for glasses. If you need both, it will be just an additional copay. And then your material copays are $15 for glasses or contacts. If you need both, it will be an additional copay as well. So keep in mind that your allowance is every 12 months. So if you went to your eye doctor last November, that means that you will be eligible to receive another $130 allowance in November of 2025. Okay. If you also have an election form that each and one of you need to complete to make sure that we process your policy correctly and make sure that we make any changes to your policy, like adding or removing a spouse, or making sure that we get you enrolled if you were not enrolled last year. Shanika and Joshelle are going to be passing out those enrollment forms. Please complete them, send them back to them so we can know what policy or how to categorize your coverage as an employee only, employee spouse, employee child, or even a family plan. Keep in mind that if you wish to enroll only on medical, but you want to add your family to dental and vision, you'll be able to do that as well. So it's fully customizable. Just let us know what policies you want to be enrolled so you can get the proper deductions per pay period, which is weekly. Okay, so you have all the tiers here depending on the coverage you want for all the policies: your medical, your supplemental gap, Humana dental plan, and Humana vision. Okay, if you guys have any questions, feel free to reach out to me or any of my staff at Financial Designs at 786-388-0030, or you can also send me an email at tony@fdnational.com. Thank you so much and have yourself a wonderful day. Take care.